So this is going to be a short video in which I'm going to talk about sodium chromoglycate eye drops. Now these are a truly fantastic medication that in the United Kingdom are available over the counter and which are used to relieve itchy eyes. So they're a symptomatic relief medication. So in the UK they are over the counter, so we split medicines in the UK into three main classes: prescription only medicines, which require a prescription to get them. Then there are pharmacy only medications. Now, these are medicines that you don't need a prescription for, but you can't just go to a supermarket, go to the drug aisle, and select them off the shelf and then take them to the checkout. Instead, you have to actually go to a pharmacy, and they won't even be on the shelves in the pharmacy for you to peruse. Instead, they will be on shelves behind the counter. So instead, you actually have to go and talk to one of the pharmacy's members of staff, and they might ask you a few questions before actually agreeing to sell you the medicine. So it's a behind counter pharmacy medicine. So that's another class of medicines. And then there are the truly over the counter medicines, which you don't even need to go to a pharmacy. You can go to a big supermarket that has a drug aisle, and you'll be able to select them off the shelves yourself, take them to the checkout. And yes, the checkout might want age verification. It might be the case that you have to be over 16 to be able to buy it, but as long as you're over 16, there'll be no further questions asked. And sodium chromoglycate in the UK falls under that category of medicine. You can buy it on supermarket shelves, at least the eye drop form of sodium chromoglycate. So I've got here the BNF page for sodium chromoglycate. So the BNF is absolutely wonderful. It stands for British National Formulary, and it is what used to be a book, but now it's a web page where you can search for any drug that you want to prescribe, and it will have a page in the BNF, and this page will tell you important information like what the drug is used for, the doses it can be used for and it also tells you, importantly, contraindications, which are people who you should not prescribe this medicine to if they've got any of these conditions. Cautions, which are, if the person has any of these conditions, be very cautious about prescribing this medicine. It will also tell you about what if the patient is pregnant or breastfeeding, is this medication safe? It'll tell you about side effects. It also tells you about medicinal forms, so it actually tells you what forms it's available in. Is it available as a liquid? Is it available as a tablet? Is it available as a capsule? Is it available as eye drops? So this is absolutely fantastic, and as I say, you can look up all sorts of medicines on this website. The drugs that won't be included on here are drugs that aren't actually approved in the UK for prescription, so it only covers drugs that are actually approved in the UK to be prescribed. So for example, let's think of a famous example. The drug Rohypnol, very famous drug. Proper name flunitrazepam, so it's a very powerful benzodiazepine that can be used as a sleeping tablet, infamously so. Now, in some countries, this is actually an approved medicine that can be prescribed as a sleeping tablet. I believe, if the films that I have seen are accurate medically, that it is approved in the United States as a sleeping tablet, although don't quote me on that. It is not, however, approved as a sleeping tablet in the United Kingdom, so there is no page for flunitrazepam on the BNF. Another example would be the famous analgesic drug Distalgesic, proper name Coproximol. Now, 20 years ago in the United Kingdom, this was a drug that was used all the time by general practitioners as an opiate painkiller. It was a combination of paracetamol and an opiate called dextropropoxyphene. And so it was brilliant. It was used all the time as an effective opiate painkiller. However, for some reason I don't know the full history of it, but it was withdrawn, completely withdrawn, and that's been wiped from the BNF. You cannot prescribe it anymore. I do not know exactly what happened to it, but it was withdrawn. It's kind of been replaced probably by tramadol, is probably the equivalent level of drug that's now prescribed instead. But there's another example of a drug that you would not find in the BNF, so it has to be a drug that is approved for current clinical use in the United Kingdom to have a page in the BNF, either in the paper form, because you can still get the paper forms, or on now the web page here. So anyway, that's just a quick sales pitch for the BNF. Let's now actually see the page for sodium chromoglycate in the BNF. So I've literally searched sodium chromoglycate on the web page for the BNF, and you can see here indications and dose, and it's telling us what you can prescribe this medicine for. Now, ignore this bit down here. So sodium chromoglycate is actually available in other forms other than eye drops. You can get it as an inhaler, apparently. Now, I have never, ever seen a patient actually on an inhaler that contains sodium chromoglycate for asthma. However, the BNF is telling me that such a thing does exist, so maybe one day I will meet a patient who actually is using sodium chromoglycate inhalers, but as I say, I've never seen that actually used. It's cut off here, but actually below this, there is actually a use for oral sodium chromoglycate as well. Again, I've never seen a patient actually taking oral sodium chromoglycate. The only place I've ever seen this medicine used clinically and over the counter is as an eye drop, and it's only the eye drop that is available over the counter. The inhalers and the oral tablets certainly are not something that you can buy on supermarket shelves. So it's only the eye drops. So these are little bottles that contain fluid that has sodium chromoglycate in, and you can literally tilt your head back and apply them into your eyes. And what we have here is that here are some of the conditions that you can use sodium chromoglycate eye drops to relieve the symptoms of, and you apply them to the eye, and it's applied 4 times a day, and it can be used in both children and adults. Now, what does the medicine do? It relieves the sensation of itch. I want to say this again and again. The actual thing that it does is it's a symptomatic treatment. It takes away the itchy sensation. So if you have itchy eyes for one of these reasons, and these are the most common reasons to have itchy eyes, but it will work for other causes of itchy eyes as well, it will relieve the sensation of itch. And itchiness is very bad. Itchiness, let's say you've got allergic conjunctivitis, and we'll talk a little bit more about what that condition is in just a moment, but let's say you have that, and your eyes are really itchy as a result. If you actually itch them, and the temptation is very strong when you've got itch, to actually itch them, it will make the condition 10 times worse. It's just like eczema. Eczema, if you actually itch eczema, the inflammation gets so much worse, which is why we give people creams to try and stop them itching, or actual oral antihistamine tablets to stop them itching in eczema, because the itching makes the condition so much worse. It's the same in the case of the eyes. If you actually itch your eyes, rub them, the inflammation is going to get so much worse. Your eyes are going to become redder. In addition, you'll get sort of periorbital edema, so your sort of the tissue around your eyes will swell up with edema acutely. So itching your eyes is not good. So using a medicine to stop the itching sensation, to stop you from doing that, is going to actually help the condition, as well as taking away that symptomatic, that unhelpful and unpleasant symptom. So that's what sodium chromoglycate eye drops do. And also, the alternative to them is taking oral antihistamines. Now, oral antihistamines are incredibly effective at also getting rid of the sensation of itch, but they have lots of side effects. If you take an oral tablet, it will have more side effects than just applying a topical medicine in general. And it's the case with oral antihistamines. You know, they will make you feel tired in most cases. Now, modern ones like cetirizine and loratadine and fexofenadine are usually better for this. They're usually not as bad for making you tired as the old ones like chlorphenamine and diphenhydramine and promethazine. But the new ones still have that side effect to a degree, and often people do find, at least initially when they start taking even cetirizine, that they do feel tired after taking it, more tired than they were before. So avoiding the systemic side effects of antihistamines to get the same anti-itch relief is excellent, and that's something that you can get with sodium chromoglycate eye drops. In general, applying a topical medicine to the affected area is better than taking an oral drug that is going to affect the whole of the rest of the body to just relieve a symptom in a tiny little area like the eyes. So that's really what the use of sodium chromoglycate is. It's a topical thing that you can apply to the eyes to relieve the itchy sensation, as opposed to having to take an oral anti-itch tablet that is going to have lots of systemic side effects. Now, let's just talk about the conditions then that will result in itchy eyes. So this is the main one here, allergic conjunctivitis. Let's just draw a picture of the eye from the front. So this is looking at someone's eye here. So we have the iris here, the pupil in the centre, and then this white part of the eye is called the sclera. Now, if you remember anatomy from medical school, or if you're someone who never went to medical school and would just like to know a little bit of anatomy, then it is the case that these things that you're seeing, and which have names, aren't actually the most superficial structure. There are invisible membranes that you can't see here. So there is an invisible membrane that covers the white of the eye, covers the sclera, and that is called the conjunctiva. And conjunctivitis means inflammation of the conjunctiva. There is also an invisible membrane over the iris part, the coloured part of the eye, and that's called the cornea. Now, inflammation of the cornea is called keratitis. So keratoconjunctivitis means inflammation of both the cornea and the conjunctiva. Now, we'll focus on allergic conjunctivitis. Conjunctivitis is much simpler. Keratitis is much more serious. So conjunctivitis, inflammation of the conjunctiva, it just causes this bit to get an increased blood supply. So inflammation causes increased blood flow to the area. So it causes the conjunctiva to go red, and then you've got the whites behind it of the sclera. So you end up with a sort of pinky colour. So it is classically known as pink eye conjunctivitis. And it's not a particularly sinister condition. It's irritating, it's unpleasant, it'll cause your eyes to be a little bit sore, and if it's an allergic conjunctivitis, it will cause them to be very itchy as well. But it's not going to damage your vision, and it's not going to cause you to go blind. More severe conditions, so there are other horrible things that can turn your eye pink or red even. And if the inflammation is coming from deeper in the eye, and these are the conditions that can cause real damage, deeper inflammation in the eye, so inflammation, for example, of the sclera, or even worse, further back in the eye, they might cause the eye to go red. Those conditions are going to be so much more painful than conjunctivitis. If someone has red eyes bilaterally and they are describing it just as mildly sore, then it is likely that that is just conjunctivitis. If they have red eye just on one side and they are describing it as agony, do not diagnose that as conjunctivitis. Send that to an eye specialist for them to actually properly look at it, because they might have inflammation further back that could cause real damage. So conjunctivitis should just be pink eyes, usually bilaterally rather than unilaterally, and it should just be mildly sore, not extremely painful, and vision should not be affected is the other key thing. That vision should be absolutely fine, and that's how keratitis is different. If you've got inflammation of the cornea as well, this might turn from being a clear membrane, the cornea, to instead being sort of opaque, hazy, and therefore it can actually disturb their vision. And really bad keratitis, if you end up with permanent hazing of the cornea, can cause blindness and potentially need surgical intervention to fix that. So keratitis is more serious, and I would not like to diagnose keratitis. I would get an eye specialist to deal with that. So conjunctivitis is really one of the only eye conditions that I am happy to deal with, and everything else you get the ophthalmologist to deal with. So conjunctivitis, let's talk about conjunctivitis. Let's ignore this one that has keratitis as part of it. Conjunctivitis has two main flavours. There are infective conjunctivitis, and then there is allergic conjunctivitis. Infective conjunctivitis can be either viral or bacterial. It is more common, in my opinion, that it is viral. So if you have a bad cold, the virus can actually go to your conjunctiva as well and cause conjunctivitis. So you might have a stuffy nose, a sore throat, and pink eyes. That is likely viral conjunctivitis. It will usually be bilateral, and it will resolve on its own after a few days. It's unpleasant. You'll have sore eyes. They won't usually be particularly itchy if it's viral conjunctivitis, just mildly sore. Then there is bacterial conjunctivitis. That is nastier. It can be single-sided or it can be both-sided. Again, it's very similar to viral conjunctivitis. It will be red eyes, but you'll get more pus, sort of like a yellowy, pussy sort of substance building up. Usually it collects on the eyelids, so on the eyelashes you might see a sort of yellowy, crusty stuff. That's when you get suspicious of bacterial conjunctivitis, and often it can be the case that someone might start off with viral conjunctivitis and it might turn into secondary bacterial conjunctivitis. But sometimes bacterial conjunctivitis can start from the beginning. And in many cases, it might just self-resolve if you leave it alone, that the body will fight off the bacteria by itself. But just in case it doesn't, we usually treat that with an antibiotic eye drop containing chloramphenicol is the first line one. I might just write that down. So chloramphenicol eye drops. And these are actually available as well. You don't need a prescription for them in the United Kingdom, but they are not an over-the-counter medicine, they are a pharmacy medicine. So you would have to go to a pharmacy. They won't be on the shelves in the pharmacy. You'll have to speak to the staff. I think chloramphenicol eye drops are usually kept in a fridge as well, so they're definitely behind the counter and you have to get get a pharmacist to agree to sell you the medicine, but you don't need to go to a doctor in order to get the chloramphenicol eye drops, but they will want to have a look at your eyes and see that they agree that there is a possibility of them being bacterially infected before they sell you that. Or you can buy it for someone else, but you might have to bring a picture along to show them of what their eyes look like, or at least give a description of what their eyes look like. So chloramphenicol eye drops can be used for bacterial conjunctivitis. So anyway, those are just sort of side points. We're interested in allergic conjunctivitis, and allergic conjunctivitis is the one that's really itchy. Now, unlike the infective conjunctivitis, which are acute problems, they come on quickly and they last for probably a few days and then they'll go away and you might be lucky enough to never get them again in your life. Allergic conjunctivitis instead goes on and on for months, maybe years. So you'll have red eyes that will wax and wane, you'll have good days and bad days, but it will go on and on and on and on. Be a long-term chronic problem. And what is happening here is that some substance is getting into your eyes that is probably a harmless, innocuous substance, but your eyes really do not like it. Your body does not like it and is launching an inflammatory response to it. And such a response where the body launches inflammation in response to something that it should ignore is called an allergic response. So that's what allergic conjunctivitis is. Classically, it's caused by pollen. So it's therefore seasonal, and this is what we call hay fever, or it's part of hay fever. So hay fever is a broad condition. It means an allergic reaction to pollen, and some people will get the reaction in their nose and they'll get really runny noses at the time when pollen's very high, and that's allergic rhinitis. That's a form of hay fever. Other people might get allergic conjunctivitis in response to pollen. That's another form of hay fever. Some people might be unlucky enough to get both, and that's another form of hay fever. So hay fever, there's a spectrum of different ways hay fever can manifest, but it's an allergic reaction to pollen, and one example of hay fever would be allergic conjunctivitis, and it is clearly going to be a seasonal condition. It's going to be worse at the times when the pollen level in the air is at the highest. So that's hay fever. That's a major cause of allergic conjunctivitis, where the allergen is pollen. However, there may be other allergens that people can react to and can be getting in people's eyes. So there are forms of allergic conjunctivitis outside of hay fever. So overall then, allergic conjunctivitis is the main condition that you would be using these Chromoglicate eye drops to treat. As I say, viral and bacterial conjunctivitis, they tend to not be that itchy. Sore, yes. Red, yes, but not itchy, so you wouldn't really have any need for using these eye drops. Allergic conjunctivitis in comparison is sore, red, and very itchy, and will get a lot worse if you actually respond to that itch by rubbing your eyes. So using these eye drops to relieve that itch is a very good idea. And compared to the oral antihistamines, which are your alternative way of relieving the itch sensation, they won't have those systemic side effects, mainly the tiredness that the antihistamines can cause. So I think they're an absolutely brilliant medicine that you can prescribe or people can buy over the counter. Now, just to finish with, I've got another bit of the BNF page from sodium chromoglycate. So it's a big page, too big to show in just one screenshot. So I've scrolled down here, and this is the sort of safety information about chromoglycate. So importantly, a section that is missing here is the contraindications section. There is no contraindications section on this page. So that means there are no patients who you absolutely should not prescribe this to, which is very reassuring. It means that it's a reasonably safe medicine. Now there is a caution here, but you can see that it's only when we're using inhaled chromoglycate, so the inhaler chromoglycate. It's not for the eye drops. So these eye drops are very, very safe. And here we've got side effects. So here is the bit that's relevant to us for eye drops, and it says just eye stinging. So that is something that you can get when you apply these drops, but it usually is only for maximum a few minutes after you've applied it. So when you apply it initially, it might sting a little bit, but then it will stop very quickly and you'll continue to get that relief from the itching sensation that will last for hours and hours after applying the eye drops. Finally, the sections that I haven't actually brought across are the pregnancy and breastfeeding section. So these eye drops are not contraindicated in pregnancy. You can use them during pregnancy, and they're also not contraindicated in breastfeeding. You can safely use them whilst breastfeeding. Really, the only contraindication to the use of sodium chromoglycate eye drops, as is the case for all medicines, is if the person actually has an allergy to the medicine that you are prescribing. So if someone truly has an allergy to sodium chromoglycate, then that would be a contraindication to it. But apart from that, these medicines, this eye drop medication is safe to use in everyone else. And it's highly effective at relieving the itch sensation, and it's something that I do recommend and prescribe to people with chronic itchy eyes from allergic conjunctivitis. And with that, we'll finish this video.